let's talk about long-term compliance on a plant-based whole foods diet, right? Do people who adopt your recommendations, are they able to stick with it in the long term, as in, a year after they start, or 5 years after they start, or 10 years after they start?
Yeah, Medicare is now covering my program. We were, as you mentioned in the introduction, it took 16 years of review for them to finalize. They actually created a whole new benefit category. It's coming under what's called intensive cardiac rehabilitation. And if anyone's interested, by the way, who's watching this, who wants to learn more about our program in general, just go to our website. It's Ornish, ORNISH.com. Everything on there is free. It has, cooking classes and online community and all the research studies we've been talking about in PDF form and so on. But also it talks about the sites. We're training hospitals and clinics and physician groups around the country in this program. And one of the things that Medicare wanted to look at before they covered it, and one of the reasons they took so long, was what are the long-term outcomes? And we found in randomized trials that people, the longer we follow people, they show more improvement after a year than after a month in their heart disease, more improvement after 5 years than after 1 year, and so on. But we're getting 85 to 90% adherence in every site we've trained throughout the country. We've trained altogether over 80 or 90 of them over the last 20 years. Some of them closed down early on when we got these great outcomes, but we didn't have the reimbursement. That's part of what led me on this journey to spend 16 years to work with Medicare to get coverage. I've learned that if it's not reimbursable, it's not sustainable, but now it is. And now that Medicare is paying for it, most of the other major insurance companies, Aetna and Blue Cross, Blue Shield, Anthem, HMSA, and others are covering it as well. And it's because we're getting bigger changes in lifestyle, better clinical outcomes, better adherence, and even larger cost savings than anyone's ever shown before. We at one point we trained 10 hospitals in West Virginia, which has been #1 in the country in heart disease the last 20 years. It's like, as Frank Sinatra used to sing, if I can make it in West Virginia, I can make it anywhere. And we're getting 85 to 90% adherence there in all the sites that we train. We've learned what enables people to make sustainable changes. And it's not what I was trained to do as a doctor and what most doctors do, which is to try to use fear and to scare people into changing. You've got diabetes, put that burger down or put that Coca-Cola down, or you're going to get, we're going to have to cut off your fingers, whatever. That just doesn't work. I mean, fear is great for like a month or two after someone's been hospitalized or they've been to the emergency room. They'll do pretty much anything that their doctor or nurse says, but not for much more than that, because fear is not a sustainable motivator in any area of activity. I used to get in debates with Al Gore about this, and because more global warming is caused by livestock consumption than all forms of transportation combined. And so now he became a vegan for that reason, which I thought was great, even though he's a cattle rancher. And so I just learned that, that what does work is if it's fun, if it's makes you feel good, if you have a lot of love and support, and if it's you feel like you're making these choices, those are the things that are sustainable. And so it turns out that because these underlying biological mechanisms are so dynamic, when you make these changes, either small gradual changes or big rapid changes, sometimes big rapid changes are actually easier to see the benefits because you feel so much better so quickly. It reframes the whole reason for making these changes from fear and prevention to feeling good. It's like, oh, I feel so much better when I do this. Your brain gets more blood. You think more clearly. You have more energy. You can grow so many new brain neurons in just a month or so that your brain gets measurably bigger, particularly those parts of your brain that you want to get bigger, like the hippocampus that controls memory. Your skin gets more blood, so you don't age as quickly. I'm 103 years old. I look pretty good. I'm 60.
Really?
I feel really great. Your heart gets more blood. Your sexual organs get more blood flow. It's the same way that Viagra works. It dilates arteries in the same way. And for many people, those are choices worth making. And particularly, a lot of people don't want to be on medications the rest of their life. And particularly with type 2 diabetics, if you can reduce or get off those medications, first of all, your own pancreas can control your blood sugar minute to minute much more than even an insulin pump can do. And so you're going to have fewer complications because if you can wake up your insulin receptors and make them more functional so that you can keep your blood sugar down without drugs, that's going to work a whole lot better. The insulin makes you gain weight, which then makes you need more insulin. You can create all these vicious cycles. The cholesterol-lowering drugs, 13% of them, end up with type 2 with diabetes as a result of the drug, which is so ironic since, you're taking drugs to prevent heart disease, and yet diabetes is one of the major causes of heart disease. And so you can get out of all these false choices and bad choices and Sophie's choices and just say, wow, you know, my body can begin to heal. But more than that, it's not about preventing something bad from happening, although it can help to do that. It's about feeling better, and that's ultimately what makes it work. And the love and support is really a key component of that. So this is a good time to rely on your friends. You know, we tend to think of the time that we spend with our friends and family as the, you know, the luxury after we've done all the important stuff, then maybe I can spend some time with my friends and family. I wrote a book about this, you know, in 1998 called Love and Survival, that reviewed what were then hundreds and now literally thousands of studies showing that people who are lonely and depressed and don't feel much love are 3 to 10 times more likely to get sick and die prematurely from virtually all causes when compared to those who have a sense of love and connection and community. So diet's important, but sometimes it's fairly hard to change your diet if you're not dealing with these other aspects. If you don't deal with the love, if you don't deal with the stress. I mean, I'd often ask people in our studies, you know, why do you eat junk food? You know, why do you get drunk? Why do you work so hard? Why do you abuse yourself in some of these ways? These behaviors seem so maladaptive, and they kind of look at me and say, like, you don't get it. You don't have a clue. These behaviors aren't maladaptive. They're very adaptive because they help us deal with our stress, our pain, our loneliness, our depression. I've had patients say things to me like, you know, fat coats my nerves and numbs the pain, or food fills that void, or I've got 20 friends in this pack of cigarettes and they're always there for me and nobody else is, or video games numb the pain, or working all the time is a more socially acceptable way of doing that, or, you know, spending too much time watching television. You know, we have lots of ways of trying to numb or distract ourselves or literally or figuratively bypass that pain. It's very hard, and especially if you get diagnosed with diabetes and say, oh, God, you know, I'm gonna have to deal with this the rest of my life. You know, that sucks. I hate that. And that just makes you depressed, which makes it, you know, hard to really eat and make healthy choices. So if you don't remember anything else that we've talked about today, spend as much time as you can with the people that you love and care for, because that will have as much of an effect on healing yourself, and it will enable you then to make the healthier choices in your diet and these other areas. But if we don't address those underlying, the psychosocial, the emotional, even these spiritual dimensions, it's very hard. We know that information alone is not enough for most people to even quit smoking. It's not like I tell somebody, hey, I want you to quit smoking. It's really bad for you. And they go, gosh, I didn't know that. I'll quit today. You know, it's like everybody knows it's bad for them. So we have to work at a deeper level beyond just the behaviors and beyond just the information to these deeper issues that really matter so much.